Hello, my name is Sonse Raju. I'm a program officer in the NIH ECHO office managing the Idea States Pediatric Clinical Trials Network, or ISPCTN. Thank you for your interest in this new funding opportunity titled Data Coordinating and Operations Center for the ECHO ISPCTN third cycle. The purpose of this webinar is to provide potential applicants with an overview of the ECHO program and ECHO Idea States Pediatric Clinical Trials Network. I intend to provide an orientation to this funding opportunity announcement and answer some frequently asked questions. In 2016, the NIH launched a nationwide program called the ECHO program. The mission of the ECHO program is to enhance the health of children for generations to come. The ECHO program research on child health and development focuses on 5 key pediatric outcome areas that have high public health impact. These areas are pre, peri, and postnatal health, upper and lower airway conditions, obesity, neurodevelopment, and positive health. Following a congressional mandate, the NIH implemented IDEA programs in 1993 with a goal to broaden the geographic distribution of NIH funding. These programs support faculty development and institutional research infrastructure enhancement in IDEA states that have historically received low levels of support from NIH. In addition, the programs serve the unique populations in the IDEA states which are predominantly rural or underserved. The 23 states and the Commonwealth of Puerto Rico are named as Institutional Developmental Award eligible states, and they are shown in this slide. I'm going to read the names of these 23 states and Puerto Rico in an alphabetical order. Alaska, Arkansas, Delaware, Hawaii, Idaho, Kansas, Kentucky, Louisiana, Maine, Mississippi, Montana, Nebraska, Nevada, New Hampshire, New Mexico, North Dakota, Oklahoma, Puerto Rico, Rhode Island, South Carolina, South Dakota, Vermont, West Virginia, and Wyoming. In 2016, NIH established the ECHO IDEA States Pediatric Clinical Trials Network. The overall goals of the network are to provide children from rural or underserved populations access to state-of-the-art clinical trials, build pediatric research capacity within the IDEA states so that they can conduct these trials. Additional goals are to engage communities and interested parties in the ISPCTN research processes and to enhance diversity, equity, inclusion, and accessibility in workforce and among the participants. In this slide, I am showing the NIH ECHO program that has two main components. On your left side is the ECHO Cohort Consortium, and on your right side is the IDEA States Pediatric Clinical Trials Network, or ISPCTN. The ISPCTN is the intervention arm of the ECHO program and is the focus of this presentation. In addition, specific goals through the first two cycles of ISPCTN are listed on this slide. ISPCTN overall goals from the first cycle, that is from 2016 through 2020, were to allow children from rural or underserved populations access to state-of-the-art clinical trials and to build pediatric research capacity in the ECHO ISPCTN funded IDEA states. In the second cycle, we added engaging communities and interested parties in ISPCTN research processes, and we also required 1 to 2 junior investigators. Additional cross-cutting goals added in cycle 2 include to enhance diversity, equity, inclusion, and accessibility in workforce and research participation. Section 1 of the RFA, you will find a high-level description of this funding opportunity. This RFA invites applications from entities and institutions in the idea states to participate as Data Coordinating and Operations Center, or DCOC. This announcement runs in parallel with the companion RFA-OD-24-009, soliciting applications for clinical sites within the idea states. The DCOC and clinical sites together will form the ECHO ISPCTN. There are 4 major areas of expectation for the DCOC. Supporting clinical sites to conduct clinical trials, clinical trial capacity building, engagement of communities, and administrative and operational support. Expectations for supporting clinical trials include assisting in protocol development and their implementation, sponsoring investigational new drug or IND, or investigational device exemption or IDE as needed, coordinating ISPCTN committees such as Data Safety Monitoring Board, Single Institutional Review Board, and other ISPCTN committees. Assisting the site investigators in developing study budgets, establishing subcontracts, dispersing capitation funds to the sites, monitoring and reporting study budgetary details to the NIH, and data management, which is establishing systems for quality assurance, monitoring study progress, participant safety, adverse event monitoring, data on enrollment, and providing data on retention and diversity, and conducting clinical site visits. Clinical trial capacity building expectations include developing and providing core curricula for ECHO ISPCTN investigators, focusing the curricula on pediatric topics, clinical trial designs, trial implementations, publication of research findings, and the principles of good clinical practice. Partnering with existing experienced clinical trial education providers to leverage expertise and resources to reduce costs and to ensure that the network researchers are exposed to high quality content. And to monitoring the uptake of the curricula by clinical site investigators and adjust the dissemination strategy as needed to ensure a widespread participation by the clinical site investigators and research coordinators in all the educational activities. DCOC expectations regarding the engagement of the communities, participants, and other interested parties include supporting the clinical sites to engage community members, non-profit organizations, and professional society to strengthen and enhance ECHO ISPCTN clinical trials. Supporting in the dissemination of aggregate research products to the lay public and scientific communities by developing a communication plan so that interested parties can access clinical trial related information such as protocols, scientific publications, and study summaries. And developing communication plans for press releases, newsletters, social media posts, and an ISPCTN specific website linked to the existing ECHO program website called echochildren.org. Additional expectations include administrative and operational support, that is to provide logistical support for ISPCTN communities and working groups, to provide a dashboard that reports progress of the network overall and for each clinical site towards the attainment of their goals, objectives, indicators, and targets, or GOIT, that have been developed by the ISPCTN network. And other administrative and operational supports are described in the RFA-OD-24-009. With the available funds, the NIH intends to fund one applicant, corresponding to a total of $8 million for fiscal year 2025. Future year amounts will depend on annual appropriations. Applicant can request up to $1.75 million in direct costs for core infrastructure expenses in supporting and facilitating ECHO ISPCTN operations. That include completion of ongoing trials and development and implementation of the 5 new clinical trials. Core infrastructure funding will also support DCOC's role in facilitating the work of ISPCTN and committees and oversight bodies. In addition, the applicants should budget $3.5 million per year in direct costs for protocol-specific expenses that should be available for distribution to the ISPCTN clinical sites as capitation fees for conducting clinical trials. The award project period is for 5 years. Eligibility information for the institutions that can apply include institutions of higher education, non-profit entities other than the institutions of higher education, for-profit organizations, local governments, and of course the federal government. Only the institutions located in the 23 IDEA states and Puerto Rico are eligible to apply as the lead applicant organizations in response to this RFA. I'm going to read the names of these 23 states and Puerto Rico in an alphabetical order. Alaska, Arkansas, Delaware, Hawaii, Idaho, Kansas, Kentucky, Louisiana, Maine, Mississippi, Montana, Nebraska, Nevada, New Hampshire, New Mexico, North Dakota, Oklahoma, Puerto Rico, Rhode Island, South Carolina, South Dakota, Vermont, West Virginia, and Wyoming. To enhance the research expertise and potential to build capacity to include needed expertise on multi-center clinical trial proposals, ECHO ISPCTN clinical site and DCOC applicants may propose collaborations. Applicants may consider collaborating with other components or investigators within their own state or in other IDEA or non-IDEA states. For partner institutions from non-IDEA states, total budget per year should be no more than 25% of the total annual cost awarded to the applicant organization. Applicants are encouraged to leverage resources and facilities supported by other NIH programs, such as the IDEA program Infrastructure for Clinical and Translational Research, or IDEA CTR, and the Clinical and Translational Science Award, or CTSA program. A letter of intent is not required. However, such a letter helps NIH staff to estimate review workload and accordingly plan for the review of applications. In the letter of intent, please include the 5 elements listed here, namely descriptive title of the proposed activity, PDPI contact information of the other key personnel, participating institution or institutions, and the number and title of this RFA. Please address the letter of intent to Dr. Lisa Steele, spelled as Lisa, first name, Steele, Steele, last name, PhD, Centers for Scientific Review, MSC 7768, 6701 Rock Ledge Drive, Bethesda, Maryland 20892-7768. Her work phone number 301-257-8255. 2638, and her email address lisa.steele@nih.gov. Key dates are letter of intent, which is optional, is due on April 1st, 2024. Application due date is April 15th, 2024. Scientific merit review is October 2024. Advisory Council review is January 2025. Earliest estimated award date is May 2025. And then the earliest estimated start date is June 2025. Some suggestions for all applicants are shown on this slide. Please read both funding opportunity announcements for the third cycle of ISPCTN that have been published. And these are RFA-OD-24-008 and RFA-OD-24-009. Please read both frequently asked questions or FAQ files, which are available on this website. And these are the Word file for the clinical sites RFA, OD-24-008, and the Word file for the Data Coordinating and Operations Center RFA, OD-24-009. And please see both webinars available on this website, which are one for the clinical sites RFA and the other one is for the Data Coordinating and Operations Center RFA. If you have additional questions, please feel free to send me a note. My name is Tonse Raju. I'm going to spell that. My first name, Tonse, and my last name, Raju. And my email address is tonse.raju@nih.gov. Thank you very much for your interest in this funding opportunity announcement.